Imagine being diagnosed with a condition so vague that sadness, desire, ambition, or even a sleepless night could condemn you. A condition that, for centuries, justified locking women away, mutilating their bodies, and silencing their voices. In some cases, it even ended with a hole drilled into the skull. For centuries, medicine stumbled in the dark when it came to understanding the female body. Among the most disturbing chapters of that history is the treatment of so-called female hysteria, a diagnosis so broad and ill-defined that almost any physical or emotional complaint made by a woman could be placed under its banner. From the ancient world to the early 20th century, hysteria became a convenient label for everything men could not understand in women: nervousness, sexual desire, grief, defiance, ambition, or even intellectual curiosity. The word hysteria itself comes from the Greek hystera, meaning uterus. In ancient Greece, physicians believed that many of a woman's health problems originated in her womb. Hippocrates, often called the father of medicine, subscribed to the theory of the wandering womb, the belief that the uterus could move freely throughout a woman's body, causing various symptoms depending on where it settled. If it drifted toward the head, it was thought to cause fainting, anxiety, or irrational behavior. By the Middle Ages, hysteria had fused with spiritual and moral judgment. Women showing signs that today might be recognized as depression, epilepsy, PTSD, or sexual frustration were often accused of demonic possession or witchcraft. Treatments were brutal. Exorcisms, public shaming, isolation, and even torture or execution were common. Mental illness was viewed less as a medical issue and more as evidence of sin or spiritual weakness, and women bore the heaviest burden of suspicion. As Europe entered the Renaissance and early modern period, medicine became more formalized and professionalized. Male physicians began replacing midwives and traditional female healers, and treatments for hysteria grew more invasive and authoritarian. The uterus was still the prime suspect, but now through a scientific lens that was no less flawed. Doctors believed the womb could become suffocated due to a lack of sexual activity or menstrual flow. Prescribed cures included marriage, childbirth, or even manual stimulation, interventions that blurred the line between medicine and abuse. One of the most extreme treatments for hysteria, particularly between the 17th and 19th centuries, was trepanation, the act of drilling or scraping a hole into the skull. Trepanation is one of the oldest surgical procedures in human history, dating back to prehistoric times. It was originally used to treat head injuries or release evil spirits believed to cause mental illness. But in the context of female hysteria, it reflected a chilling shift, the belief that women's brains, not just their wombs, were the source of instability and disorder. In early modern Europe, trepanation was typically reserved for women who exhibited severe psychological symptoms: hallucinations, seizures, uncontrollable fits of weeping or laughter, or violent outbursts. These were all, at various times, diagnosed as hysteria. The assumption was that drilling into the skull would relieve pressure or correct imbalances in the brain's fluids. Some doctors even believed it would literally vent the madness trapped inside. Medical theory still leaned heavily on the ancient Greek concept of the four humors: blood, phlegm, yellow bile, and black bile. Health, it was believed, depended on keeping these fluids in perfect balance. An excess of black bile was thought to cause melancholy, making trepanation a drastic but reasonable option to restore equilibrium. Although trepanation had been performed on both men and women since antiquity, its application to hysteria had a distinctly gendered tone. Medical records from the 18th and 19th centuries describe women undergoing the procedure not because of head trauma, but because of improper or disruptive behavior, refusing to marry, suffering postpartum depression, or expressing sexual desires outside of wedlock. In many cases, the surgery was approved or requested by male relatives, husbands, fathers, brothers, often without the woman's consent. It was less a cure than a form of medicalized control, a way to silence and subdue women who no longer conformed to social expectations. The message was brutal and unmistakable: a woman's mind could be corrected with a hole in her head. Alongside trepanation, a host of other so-called treatments persisted. Leeches, enemas, bloodletting, induced vomiting. Some physicians prescribed vaginal douches infused with herbs or opium to calm the uterus. Others recommended clitoral stimulation performed by the physician, claiming that orgasm, euphemistically called a hysterical paroxysm, could bring relief. These procedures, cloaked in medical jargon, often amounted to assault. By the 19th century, attention shifted once again to the reproductive organs. The rise of gynecology brought new, and equally invasive, solutions. One of the most notorious was oophorectomy, the surgical removal of the ovaries. Doctors believed the ovaries secreted toxins that could disturb a woman's mental state. The logic fit the old myth: if the womb was the problem, remove it. Soon came hysterectomy, the complete removal of the uterus, as a supposed cure for chronic hysteria and nervous diseases. These surgeries were experimental, based on guesswork, and carried enormous risks. Thousands of women were subjected to them, many dying in the process, others left with lifelong pain, hormonal imbalances, and psychological trauma. By the late 19th century, hysteria became even more socially convenient. It was no longer just about illness, it was about compliance. A woman who defied her husband, voiced political opinions, pursued higher education, or refused marriage could be labeled hysterical. From there, the path to institutionalization was frighteningly short. Asylums across Europe and North America filled with women whose only crime was nonconformity. These institutions marketed themselves as places of healing, but many were underfunded, overcrowded, and abusive. Inside, women endured treatments that were more like punishments: cold water immersion, electroshock therapy, isolation in dark rooms, forced feeding, mechanical restraints, and in extreme cases, lobotomy, the surgical destruction of brain tissue to calm the patient. It was in this environment that trepanation lingered, especially in less regulated facilities and among physicians clinging to outdated beliefs. While neurology gradually advanced, the practice did not vanish overnight. By the early 20th century, the conversation began to shift. Sigmund Freud's studies of hysteria, particularly his work with Anna O., suggested that the disorder might have psychological, not purely physical, roots. Freud argued that repressed emotions, trauma, and subconscious conflict could manifest in physical symptoms. While his theories were steeped in their own biases, they marked a move away from surgical mutilation toward talk therapy, dream analysis, and exploring a patient's inner life. It was a small but significant step toward recognizing women as full human beings with emotional lives, not broken machines to be repaired. Still, even as psychoanalysis gained ground, the attitudes behind hysteria endured. Women continued to be seen as emotionally unstable, physically fragile, and in need of medical management if they resisted traditional roles. Today, trepanation is almost extinct, performed only in rare, life-threatening cases of brain swelling and under strict surgical protocols. But historically, it stands as one of the clearest examples of how ignorance, when combined with authority and gender bias, can turn medicine into violence. The idea that a woman's suffering could be solved by drilling into her skull or removing her reproductive organs is not just a grotesque footnote in medical history. It is a mirror reflecting how society once viewed female agency, emotion, and autonomy. It's important to remember that many women resisted. Letters, memoirs, and early feminist tracts carry the voices of those who denounced their diagnoses, begged not to be institutionalized, and wrote to newspapers and medical boards about their treatment. These voices were often ignored, but they endured. They remind us that history is not only written by those in power, but also by those who suffered under it and refused to be forgotten. Modern psychiatry and gynecology now operate with a far more nuanced understanding of mental health, neurobiology, and hormonal influence. Informed consent and holistic care are the norm. Yet the shadow of hysteria still lingers, in how women's pain is sometimes dismissed, how they are overprescribed certain medications, or how their symptoms are labeled emotional while men's are called clinical. The story of when doctors drilled into women's skulls to cure hysteria is not just about medical failure. It is a story about power, silence, fear, And what happens when culture disguises oppression as science? It is a cautionary tale, one that urges us to keep asking hard questions about how we treat those whose pain we do not yet understand. If this story gave you a new perspective on the dark corners of medical history, consider giving it a like. Share your thoughts in the comments. What shocked you the most? And if you want more stories like this, don't forget to subscribe for future episodes.